So today I'm going to be talking about death investigation. What do investigators actually do? What you see on NCIS, CSI, do you actually believe that's a real, you know, representation on how to properly investigate a crime scene? Well, investigators' sole job is to find out any answers that are missing and rule out the cause of death, which are natural death, homicide, accidental death, and suicide. They need to determine the cause of death and protect the crime scene. They also need a chain of custody to for anyone entering and exiting the scene. The first responder's initial job is to make sure to secure the crime scene. The purpose of that is to restrict any access and preventing contamination or prevent evidence from going missing. Death investigators must have a bachelor's degree in forensic science, and become certified through the American Board of Meteorological Death Investigation. American Board of the Meteorological Death Investigation. The training involves rigorous courses such as DNA analysis, criminalistics, microbiology, crime scene investigation techniques. So their salary can range from anywhere from $64,000 through $82,000 annually. So there are three main types of death, which can include blunt force, sharp force, or asphyxiation. Blunt force trauma is from an object that causes contusion within the body. So either with a bat or something heavier. A sharp force object can cause traumatic separation from the tissue. So the three types of sharp force injuries can include a stab wound, incised wounds, or chop wounds, which is anything particular in sharp objects. Asphyxiation is the involvement of lack of oxygen, so it can be caused by fire or strangulation. I'm going to be talking about Marilyn Monroe. Her death is still remains to be unsolved and a mystery. So what I believe in is she was murdered by her psychiatrist, her lover, and her other lover. So her body was found lying in a very unnatural position to be considered for someone who just had just committed suicide. Many attempts were failed to knock down her bedroom door. Experts have identified that the window was broken through the inside, but staged to be broken from the outside, which really cannot be. It's impossible. Greenson, her psychiatrist, and Eunice Murray, her housekeeper, said that they found the bottle of pills just lying on her desk, but there wasn't a glass of water anywhere. Her pills were left untouched. Marilyn was known for being sexy and being just a role model to women everywhere. She was said to have an affair with both of the Kennedy brothers, so Robert Kennedy and Bobby Kennedy. She became obsessed with John and loved him and wanted him to leave her with Jackie, but he wouldn't do that to Jackie because he loved Jackie very much. And so she would call his house, spread rumors about him, said that she was carrying his baby, but John was like, no, this is not true. So did he order her death by her psychiatrist just because of all of the drama she's been causing around? So John ordered her death by her psychiatrist Greenson to give her a lethal injection of pentobarbital, enema, and Numitol. So that's what one of the possibilities that her death was a murder, because her body was laying very in an unnatural position for someone who quote unquote committed suicide. So a pathologist are required to give the time of death through rigor mortis, livor mortis, and algor mortis. Through algor mortis is the body that continues to cool down until it reaches room temperature. Livor mortis is when the body is settling through the area of the body which is closest to the ground. So if you're laying face down, the blood is going to be rushing through the head and through, the chest region. So rigor mortis is stiffening of the muscles, which begins 24 hours and disappears after 36 hours after death. Determining the characteristics of bones can differ from female to male and infants. With female bones, they are wider, more circular, shorter, and slender, just because we have those childbearing hips, which makes them wider than males. Males have a cranium, brow bone, and mastoid process, which are more pronounced, which gives them their sharp features. And an infant can vary on their age, examining their femur and humerus. So if you do that, then you can determine how old they were or how far along they were from becoming a year old to 2 years old. You can also determine their age by their formation of their teeth. 24 hours within the death, the insects will feed on the dead tissue, which is a decompositioning of the body, and they would come and eat at the living organs, the tissues, the muscle. The blowflies will lay their eggs and hatch onto the maggots or larvae and will feed on human organs and tissues. Postmortem interval is the length of time which has passed and the person has died. Environmental factors can have a huge impact on this, and it can hinder the development of algor mortis, rigor mortis, and livor mortis, and can hinder the development of the fly eggs, and they're transitioning to adult flies. So an open wound will allow the insects to affect this area and will feed off the body first if a drug is presented in the body. So if it was a natural death and the person overdosed on Oxycontin, heroin, anything like that, the blowflies will infect the area first and eat at the organs. So thank you for watching, and bye.